I'm really excited to be here today, and I'm the last presentation, so thank you for staying till the end of the conference. A little bit of an introduction to me. There's my glamour shots by Deb. Had to think of warm seahorses or whatever it is. My experience through my career will kind of go from the bottom up. I started with the Boy Scouts of America. I did a lot of fundraising, program development, recruiting of new Cub Scouts and adult leaders, kind of some community engagement and outreach. Really, it's my education here in the IMC program that kind of transformed my career and helped me have the opportunity to teach in social media marketing at the University of New Mexico, as well as work for the largest state agency in the state of New Mexico, the Department of Health. I also cover the Aging and Long-Term Services Department, so all of the senior community-based services that are provided. My current work works closely with the governor's office, for the governor of New Mexico. I have a team that includes a graphic designer, another public information officer, and we're soon to hire someone that will help us to also handle and balance our internal communications. But before I get started, get too far into my presentation today, I want you to pull open your phone and go to this link, paulev.com/paulrhien674, and there'll be some interactive element to my presentation today. I'm leaving up that link there at the bottom of the screen. New Mexico, I'm from New Mexico. This is the place that I love. What is in New Mexico? Bottom left-hand corner, you've got the International Balloon Fiesta every fall, where hundreds and hundreds of balloons launch each morning that there's good weather. We have some of the best cuisine. In the state question is red or green, red chili or green chili, or Christmas if you want both. You have the Shiprock and the Navajo Nation near to my hometown of Farmington, and then the beautiful Rio Grande Valley and the Sandia Mountains with the state capital there in the middle. We have kind of a unique state capital, but it fits our state. So everybody linked in to the link. So we're going to just give it a try to kind of show you how this works. Once you are logged into that site, I want to make sure we get this working. All right, so you see the poll? Go ahead and answer that question. What is one word that you would use to describe your time at Integrate? All right, so here's a few words. Oh. Reconnections, inspiring, educational, informative, motivational, educational. Looks like everybody has had a good time here at Integrate. So we'll use that a couple times in the presentation today. In our time together this morning, we're going to explore how to engage with the media, how to use relationships with local or state or even national media outlets to communicate important messages for your organization, for your company, for your brand. And we're going to talk about how you can frame talking points and messaging in high-stress situations with that level of credibility and trust and authority. News journalism today is embattled. There's kind of no way around it. And in part, this may have something to do with the president having deemed the media a public enemy of the public. Fake news, alternative facts are kind of part of the reality today, and the attitude of many, if not most, that news is politically slanted isn't helping. And so you have these headlines, for example, this one from Gallup: Americans' trust in mass media sinks to a new low. And it goes on to point out that 32% of people are saying that they have a great deal or a fair amount of trust in the media. The opposite is true of those that do not have. So 2/3 of people don't have a lot of trust in the media. Our next headline is from Huffington Post. Most Americans don't think that the media is honest. The same kind of stats here, that 39% of people think that media personnel are honest. That means 2/3 of the nation thinks that the media is dishonest. Kind of playing right into the president's narrative. But we also have to consider that consumers are receiving their news from a variety of sources today. Gone are the days where we have 3 major evening newscasts. These are some of the faces that I grew up watching. I'm a little young for Walter Cronkite, and yes, that's Kermit the Frog with another fast-breaking news story, one of the great news journalists. But I've always loved the news. This is me at a young age reading the newspaper with my papa, your newspaper just doesn't, by the time it arrives in the morning, you've already read many of the stories that have broken on social media or on the news app on your phone, maybe even an alert if you're as news crazy as I am, to have news alerts on my phone or on a 24-hour news channel. And so because of that, newspapers and news organizations are having a more difficult time making profits. So let me come back here and open up this question. Which social media platforms do you regularly use to get your news? Just real quick, just to get an idea, there are 6 icons there. Go ahead and click on the one that meets, and this one you can click as many as you use. So if you use all 6, go ahead and click on all 6. You can see there though, so a lot of you use Facebook, you get your news from Facebook and Twitter, maybe some from LinkedIn. You're not necessarily using YouTube, Instagram, or Snapchat for your news, and that's fine. But you'd be interested to know that, get my notes again, that according to the Pew Research Center, you can see that 2/3 of American adults use Facebook. 45%, or almost half of all American adults, get their news from Facebook. YouTube, which none of you voted for, almost 20% of American adults say that they get their news from YouTube. And you can see as you go on down, Twitter, Instagram, Snapchat, LinkedIn are smaller percentages. But if we look at kind of the trend line, today, 1 in 4 adults get their news from multiple media sites. So you might get it from Instagram and Facebook, or Facebook and Twitter. So I imagine a lot of you clicked both or multiple buttons there. And the 2018 results will be out from Pew probably in this next month, but you can see it gradually increasing. More and more adults are getting their news from social media. And before you're quick to say, well, that's nice, Paul, I'm not a news junkie. I kind of tune out the news, makes me depressed. You really can't ignore the large audiences of your local, state, and national media outlets. And we're not just talking about traditional media outlets. In 2018, with digital media, really anyone can be a citizen reporter. They can go on and report on what they're seeing. Particularly in a crisis, we see this happen on, a lot of you said you use Twitter for your news. That's not just reporters and news outlets that are reporting those the news that you're learning. You're also getting it from everyday people. And we've had some good learning and discussion here at Integrate about influencer marketing and how, and so you can kind of, the same kind of thing applies in news. Influencers, so they're not always marketing a product, sometimes they're reporting some kind of a news. They have a large audience, they're not affiliated with a media outlet, but they still have that trust with their audience. It can be tempting, I think, given the landscape, to minimize the importance of earned media, of working with the media. But today, I really invite you to consider how engaging with the news media can still be an effective tactic in strategically reaching your audience. The PESO model, developed by Jenny Dietrich, she spoke here at Integrate a few years ago, really represents how we need a mixed approach, or a blended approach, using all four categories of paid, search, earned, and owned media. And this mix will look different for every organization, every brand. But including earned media in a balanced strategy, along with creating publicity, that includes creating publicity, media relations, blogger relations, influencer relations, investor relations. It includes a level of influencer engagement and community partners. And then you combine that with social media, content marketing, incentive marketing, paid advertising, you start to build authority and credibility and trust. And it really plays a role in helping to convert prospects into paying customers. So we're going to take a very basic approach here. What is the news? Let's just go back to what is the news. It's a business. It is about informing the public, but it's also a business. And so it comes down to what sells. Conflict and controversy sells. So does a variety of tactics that the news are trying out. When you have reporters that are kind of pushed and forced by their editors or their producers to have a social media presence and to report, to do a Facebook Live when they're out in it's no longer about what makes it to the 30-minute broadcast. Trying to drive people to the website or to their mobile app becomes really important. So the more readers, the more viewers, the more clicks, the higher the ad profit, the higher the ad rates. And so the more people they reach, the less capital they have to spend. It's really about, it is still about informing the public, as I mentioned. Most journalists are still motivated to some degree by the importance of keeping the public informed, educated, but it's also about conflict and controversy and trying to find the negative, presenting it in a way that will appeal to their audience. Sometimes you don't even have to do anything wrong. Sometimes it's simply the appearance that you did something wrong that can be newsworthy. Who are news journalists? Well, reporters come from all walks of life. Their ideology, their background, and experience can vary greatly. This is David Carl. David Carl is a West Virginia University graduate some of you may be familiar with. He moved to Albuquerque. I got to know him a little bit through some stories we were working on. And actually, today he doesn't even work for Action 7 News anymore. He's gone into a role similar to mine as a public information officer. But it is important to know the context when you're speaking to a reporter, knowing their background, a little bit of who you're talking to, and to understand the demands that are placed on reporters to meet deadlines, to like I mentioned earlier, to maybe do a Facebook Live or tweet about a story that they're working on, and to try to tease the next day's newspaper. So I want to talk about the 5 basic news values. The first is, and what makes a story newsworthy. The first is relevance. That's the impact that a story can have on the public reached by the media outlet. 3 elements of relevance: timeliness, proximity, and probability. What's happening now is probably more newsworthy than something that has happened in the past or something that may happen in the future. What is the news today? Proximity, where is it happening? Something happening locally is more newsworthy to a local newspaper, a community newspaper, or a local TV station than something that's happening further away. Sometimes they fill in their broadcast with some of those stories from further away, but the closer proximity, the more relevant it is to their audience. And then probability, what is the likelihood that this will happen again, or that it will affect their audience. Currency is kind of like the stock market. It's what stocks are high today and what's low. An example, if a beloved celebrity died yesterday of complications to Alzheimer's disease, a story about a breakthrough in Alzheimer's research treatment is going to be more newsworthy today. So it's that close tie to current news as well. Conflict and controversy, that's man versus man, man versus government, man versus corporation, man versus, well, just about anything. The media wants you to rant and rave. They want you to be upset about what's happening in your local government office or by an elected official. The news does have to entertain. Has to be funny or fun or offbeat. These are the kind of things that kind of make our serious lives more bearable. Celebrities, cute kids, animals. So kind of a fun element to the news. After all, they want you to stay on their broadcast for the full half hour and not lose you in a story that doesn't entertain or keep you tuned to that channel. And then human interest. This is what we've been talking about throughout the conference and a relevant topic in our industry, and that is storytelling. How do we tie a news story to how it affects you and your home and your family? How do we personalize a news story to touch your heart? It's one thing for us to report on in public health on the number of women that have been affected by Zika. It's another thing for us to tell you about the woman that's pregnant that risks birth complications in her newborn. So the next question is the one we started with, and that is, how comfortable are you speaking with the news media? I'll get that one live for you. This gives me an idea of who I'm talking to. How much do you work with the media? Kind of a mix. Nobody's really uncomfortable, but it's okay to be somewhat uncomfortable. And we've got some that maybe have some experience working with reporters. One thing I hope that you'll take away from today's presentation is the fact that the media, and kind of what I was trying to say in the last slide, media are people too. Reporters are people, and there's really no reason to be afraid of them or to be uncomfortable speaking to them. And we're going to talk now for a little bit about what to do when the media calls and how to handle a news inquiry or a media inquiry. So what do you do when you get that call from the media? Well, really, it depends. It depends on your role, largely. If you're a public information officer or someone with responsibility in your organization for media relations, then that's different than if that role has been designated to someone else. If that's the case, you politely give them the contact information, and then you don't have to worry about it anymore. And that's not totally true, but the PIO will help you decide who the best person is to handle the inquiry. Who's the best person? What's the best way to respond? If you're the right person to respond, then the communications staff will help to prepare you. So you're going to gather information and context What is the story about? What kind of information do they need from you? Maybe they're just calling to get some data or some information rather than a statement. Maybe they want to do an on-camera interview. You want to get the context of who they've already talked to. What do they already know? Sometimes reporters will call me and really they're just kind of fishing. They don't know exactly what question to ask. They know that they sense that there's some story out there, and they know that I know something about it, and they want to try to see what they can get from me. Other times, a reporter has researched everything. The story is basically already written. They just want to add a little statement from our agency at the end. And then, of course, the deadline, helping you to prioritize how quickly you may need to act, because reporters do work in a very fast-paced environment. Sometimes their story is going to run in an hour, or they need to get it to their editor by the end of the day. One thing about working in media relations is that my day is never my own, because I show up to work, I've decided what I'm going to work on that day, and then I get the call, and my entire day is flipped upside down. Now I'm going to be working on this inquiry. This is our state epidemiologist in New Mexico, Dr. Landon. He's one of our best interviewees. I actually rarely go on camera because I can often get Dr. Landon to speak to it, and he knows more about it. But we'll work together to prepare him and make sure that we kind of go through, and we're going to talk about preparation here in a minute, but an interview, the first quote here is from the Merriam-Webster Dictionary: a meeting where a reporter obtains information from a person. Kind of the most basic definition of an interview. But it's the most basic tool that a reporter has to get information from you that they need. And they rely on you because you know the issue, you know the players, you know the impacts that it will have on other people. There are 3 different kinds of interviews. You got print, radio, and television. In a print interview, it's going to be heavily edited. Interviews can be long, and yet they get very little goes to print, very little is used from your long interview. It can be done over the phone, doesn't have to be done in person. A radio interview, the quality of your voice matters, your intonation matters, and even a radio interview can vary. It can be recorded live, or it may be pre-recorded, it might be edited, it might be unedited. It might be done in the studio, maybe they'll do it over the phone. And then a television interview or on camera, same kind of thing where frequently it's not a live interview, they're really looking for a sound bite. And so the more you can be prepared to not ramble on about what you're trying to talk about, but give them that sound bite that they can clip out and throw into their story while they're sitting in the news truck waiting for the newscast to start. This is Dr. Landon again. One of our local stations started doing Skype interviews, and so that helped a lot because we're based in Santa Fe. The news media is based in Albuquerque, and so we're able to get Dr. Landon on Skype for their afternoon newscast, usually pre-recorded for their Skype. Because they're trying to narrow it down to 15 seconds or however long they need. Yeah?
Yeah, I'd like to add that in our market, we're seeing a lot more Facebook Live interviews too. They come to cover an event at our hospital, and they go live with it pretty much the whole time they're there.
Sure.
Walking around with the camera.
Oh, absolutely.
Like even sometimes pointing at the ground. So.
Right. And sometimes you can't even hear very well. They all need stabilizers instead of a good point. Absolutely. And that is one more element to what the kinds of interviews you're seeing. They're usually combined with the story that they're covering for that night or for that paper. So I want to talk a little bit about ground rules for working with the media, and that is that there's on the record where anything you say can be used. It might be reported, published, or aired. All conversations should be assumed to be on the record. On background is where they may not attribute or may not directly quote you, but they'll say, I talked to the spokesman at the health department and they told me, or it's kind of some information that will help them, help guide them in creating their story, but it's not specifically recorded or for on camera. There really is no such thing as off the record. You should always assume that what you're telling them will go to print. An interview is not a conversation. What I mean by that is the reporter can share everything that you say. They're not there to be your friend. They're not there to villainize you either, but they are there to gather information. You need to make sure that you are agreeing to the terms of the interview before the interview happens. You don't go on and on and on and say, oh, and that's off the record, of course. But getting their consent to go on background is important. Before the interview, so after you've gotten the inquiry and before the interview, you really need to plan and prepare and practice and practice and prepare some more and practice, given the time that you have to prepare. But you want to be accurate. You want to make sure that what you have to say is supported by facts. Gather the most current statistics or data that you can share with them. You want to understand, as I mentioned a little bit earlier, what is the context for the story? What do they already know? And familiarize yourself with the reporter and their organization before you talk to them. But really, planning the messaging is probably one of the most important parts of preparation, and that is, what is it that you want to say? What is the simple, concise statement that you can make that will convey your primary message? What do you not want to say? Identifying those things that you want to make sure and avoid, and write them down. Have your notes, even if it's just for processing it for when you go on camera or speak to the reporter. And then hope for the best, but plan for the worst. When it comes to media interviews, when I talk about practicing, that can be in front of the camera, or in front of a camera, in front of your webcam, a mirror. Do the interview with a colleague, someone who knows the issue well and can practice throwing some really tough questions at you, so you can be prepared to keep your cool and to pivot back to your primary messages. But also just there are times when I can ask a reporter for their questions in advance, but that doesn't mean they're going to stick to that script, and neither should you. You should be doing your homework to understand what are the questions that the public's going to have on this issue. Brainstorm with a colleague. Write down some of the questions that you might get on this issue so that you can be prepared. Practice your delivery in how you'll say something, how you can convey, and we're going to talk about this in a minute, but how you can convey understanding and empathy in your response. And in the interview, you have to remember it's not their interview, it's your interview. They are interviewing you. You don't have to say anything that you don't want to say. You don't have to be flustered when they ask you that tough question. You can be prepared to respond appropriately. Once you're in the interview, make the time with the reporter worthwhile for you. Make sure that you build rapport, one question at a time. Build that authority with them, and always be prepared to, I called it pivoting earlier, but to bridge back to your main message points. They may ask you an off-the-wall question, but if you can practice how to bring it back to what you want to make sure that they take away from the interview. During the interview, if you're interrupted, wait your turn. Don't you be the one that interrupts. Don't get defensive. Keep your cool, even if the interview gets heated. Don't argue. It's not a good look for you. And remember that you are representing or often speaking on behalf of your organization or your company. Some more tips for during the interview. Again, this is where understanding the context for the interview is important, because if you go into the interview understanding that you're pre-recording this for the evening broadcast, the reporter will probably tell you, but you can stop and start over. If you feel like you got flustered or you had a hard time articulating, ask them, can I give that to you again? And important thing is the first bullet point there: be first, accurate, and credible. The timing in which you respond to them can be important, because if they can get the interview with you before they go and speak to someone who doesn't know what they're talking about, or they go and get the on the street interview from somebody who they just told about the story, and they go, oh wow, that can help shape the way that the story takes place. But acknowledging uncertainty, it's okay to not know. It's better that you tell them that you don't know than making something up. Never make something up, never speculate, never assume, and maybe give the reasons for why you can't share what they're asking for. An example in my work is that we are restricted by HIPAA laws to be able to share patient information. That applies more broadly than most reporters want it to. They want to know exactly who was affected and how they were affected, and they want to go get that interview with the family. But if it was a patient receiving health care, I'm not going to share that information with them, and they need to understand why. Or maybe the reason that you're not going to share that information was mentioned earlier in the previous presentation is maybe you have an order that you want to follow. Maybe you want to address your stakeholders first. Maybe you want to talk to the family first before you talk about it publicly. During the interview, if there's something that you don't know or you don't have, tell them you'll get it to them. If it's something that you can reasonably go back to the office or make a phone call to a subject matter expert and come back to them with the answer after the fact, they'll find a way to weave that into their reporting of the story. And then in terms of keeping it simple, that's probably the most important thing about talking to the media, is keeping it simple. Don't ramble on. Be prepared to make your statement. It's been studied, and some of our friends over at crisiscommunications.net, Randy Heyer and Vincent Cavello, they work a lot in crisis communications, some in the public health space. They talk about stating your key messages in 27 words, 9 seconds, and then having 3 primary messages. You don't have to give all your supporting detail. Keep it to those simple details and hold something back so that if they have a follow-up question, you have that supporting information to give them and to go back to. And then, of course, in an interview, nonverbals are important. Really, the majority of what you have to say doesn't matter as much as how you say it and how you deliver it, and that includes with empathy. When people are stressed and upset, they want to know that you care before they know what you know. Going back to Will Rogers. Some of the common questions that you can prepare yourself with. Now, I recognize that there are a variety of situations where you will encounter the media. Some will be, and we're going to talk a minute about proactively pushing out press releases, trying to get coverage, calling up the reporter and pitching your story to them. We're also talking about responsive, and that has to do with a variety of situations. In my work, it might be an infectious disease outbreak. It might be changes to our medical cannabis program. It may be DWI testing, or any number of public health topics. You may work for a restaurant, and you still have to worry about infectious disease, or worry about a foodborne illness outbreak. Every organization is affected in some way by crises and by issues that they have to manage. It may be an incident with an employee. It may be an issue with HR. All corners of your agency or your organization can be affected by a situation. And so being prepared to talk about those kinds of things before they happen. These are some of the kinds of things that you can ask yourself when you're facing an incident or an issue that you're working through, a crisis. And that is, it really comes back to the who, what, when, where, why, and how, right? Who is it affecting? How did it happen? People want to be assured that it's not going to happen again. We had, in December of 2016, a Christmas party at the Department of Health, and we brought in a caterer, and a number of people, a good number of people, went home sick. The health department, right? And so that, and granted, we don't do restaurant inspections in New Mexico in the health department. That's the environment department. But most people associate the health department with the restaurant inspections. And so we got a lot of interest from all over the country over the next week or so. And that's something that can affect any of you. A large outbreak at after a employee get together. Consider for a minute what are the kinds of negative events that would impact your business, and be prepared to address them. This kind of goes back to practicing. It was mentioned in the last presentation, but we do large-scale preparedness exercises with a number of agencies. This was a day that I got to practice doing a news conference. We were pretending that there was an earthquake in Albuquerque, there was flooding, there was civil unrest as a result, and so together with public safety, with our Homeland Security and Emergency Management, together with our Department of Transportation, really interagency exercise where we were able to practice and exercise. We brought in the university, and the power company, all the communications team got together to practice how we would respond in real time to those kinds of incidents. And there was a train derailment too, by the way, with large numbers of fatalities in that exercise. Some of the do's and don'ts of interviewing. Keep it simple. They want that quick, short, lively quote. Keep it short. Don't give them more information than they need to know because you're nervous. And always come back to what are those points that you want to make sure and emphasize. Rehearse both easy and tough questions, and always lead with and end with your most important point. Don't be defensive. Don't, as I said, say something that you shouldn't. Going into the interview, having had a quick conversation with legal can go a long way toward making sure that you don't say something that you weren't supposed to say. And don't say no comment. There really is no such thing as no comment. That's a really bad look to say that no comment. It makes you look guilty, right? And so find a way, even if you can't comment, to have that conversation respectfully, explain your limitations, but don't say no comment. Other things to avoid in an interview are acronyms, jargon, technical terms, and make sure that they have the context for understanding if you're addressing a difficult or a technical issue. And part of that, some of the principles of messaging I want to talk about here include, bringing the level of language down to a middle school level. Think of how you would explain an issue to a 6th grader or an 8th grader, and explain it to the reporter. We're not saying the reporters have a 6th or an 8th grade education, just saying that they are reporting it to the public who may not understand the issue unless you expand upon it in that way. I want to take a little bit of time here to talk about some experiences that we've had, or that I've had in the Department of Health in New Mexico. and how we've been able to work closely with the media and engage with them to report on some important topics. And that's often not just the reactive that I've talked a lot about here today, but it's the proactive. It's sitting down with the Associated Press. It's sitting down with an editorial board and talking to them about an important issue, talking to them about things that are going to be coming up down the road, so that they can be prepared to quickly report on an important topic. One of those is the opioid epidemic. In New Mexico, we have historically, along with West Virginia, been among the worst states in the country for opioids, and opioid abuse, I should say. And so we've made a lot of progress, and yet that narrative remains among the public that we're at the bottom of every list. It's just the worst place to live. And so we want people to understand that we have made some of these changes so that they can understand how it affects them and their family, how they can be aware of what's going on in the community and not brush it off as something that doesn't affect them because they don't use opioids, but that they can understand the kinds of things. Among the changes that we've made in New Mexico, we have, sorry, let me go back here. We have strengthened our prescription drug monitoring program. What that is essentially is requiring doctors to check a database to make sure that their patient hasn't been prescribed by another doctor for the same prescription or an overlapping prescription that would negatively impact that patient. It reduces doctor shopping so that a drug user doesn't go around to different facilities trying to get more than they need. We also became one of the first state, to require all law enforcement to carry naloxone, overdose reversing drug. And we've expanded that access to pharmacists. So if someone shows up at a pharmacy that is overdosing, they can get naloxone right there and then. And lives have been saved as a result. We've also removed prior authorization for Suboxone and expanded the number of methadone clinics, the number of those that accept Medicaid. I know that's all really technical speak, but ultimately we're trying to expand treatment to those that are struggling with addiction. Here are some of the stats. In 2016, New Mexico, well, if you look on the right, in the right-hand column, we've gone from being first, second, third in highest drug overdose death rate in the nation, and we've improved. You can see there on the left-hand column that West Virginia's drug overdose death rate is 52 persons per 100,000 population. Very high rates, and something that many are working on. In New Mexico, we wanted to celebrate the fact that drug overdose deaths were down, that we've finally been able to improve to 12th in the nation, 12th highest. That's not necessarily something to celebrate, because that still means that 491 people died of drug overdose last year in New Mexico. The families, the tragic impacts of drug use. So we also wanted to weigh that message, not in a celebratory tone, but just so that people understand that we are making progress, that that the state is proactive in addressing it, and that the interventions that we are making are working. There's still work to do. That's always the underlying message to whenever we talk about opioids. There's still a lot of work to do across the entire country. And fortunately, slowly, lawmakers are starting to devote resources. Private industry businesses are coming to the table with resources. to help address it. Here's a story from 2018, in March 2018, earlier this year, where we worked together with the Albuquerque Journal, one of the state's largest newspapers, if not the largest state newspaper, to talk about that. Santa Fe, New Mexican covered something the next month where New Mexico was one of only 2 states in the country to be, from the National Safety Council's analysis, to be applying all 6 policy-making interventions that they deemed were necessary to be able to fight the epidemic. That story also, sorry, to go back, that story also saw some national interest, and I'm going to skip, actually it's this one, sorry. Partially because the National Safety Council did a good job of reaching out to local news media. And if you have a Hearst station in your media market, you're familiar with this state of addiction. They've
It started off as a wreck involving 2 cars.
Sorry. I've been really impressed with this State of Addiction series. It's something that has run now for the last couple of years. This particular news station has done a really good job of trying to look at every angle of the opioid epidemic. They've looked at everything from drug trafficking and enforcement. They've talked about sports injuries and how someone who's never had an opioid before is now suddenly addicted. They've talked about some of the interventions that we've made. It's been a good partnership for us to be able to work closely with their reporter to help her identify topics and ways that we can, places where the health department can be involved in that conversation. Here's another, this is actually from just this last week. And a good example, I think, of how to use multiple tactics from our IMC toolbox. Earned media and news media engagement was really only part of that. This was how we launched the campaign, and that is that we got a generous grant from Pfizer to be able to work on a public education campaign that focuses on prevention. A lot of our interventions are just that, they're interventions. They're how do we handle it after the overdosing patient is found, but here we are, how do we educate people as to alternative pain management? How to have that conversation when the doctor gives you the prescription that, do I really need that much? Or what are some other things that I can do? Because in many cases, and I think doctors are getting a lot better, but so we launched a campaign just this last week. We were fortunate that this was one that the governor wanted to get behind and help us to get the word out. And then here's a poster that is going to be used. The PR agency that we're working with is working on sending home flyers with kids in their backpacks to go home to parents. Working on community service organizations, Rotaries, Kiwanis clubs that we can go and speak at. We have a TV, actually I think it's just a radio public service announcement running for the next several months about there is another way. That alternatives to prescription opioids do exist, and to have that conversation. A few other experiences that I've had, and then we'll wrap up and turn some time over for questions. But here are some other issues that we've worked on. On the left-hand side, you have our Department of Health Cabinet Secretary with Governor Martinez. This is usually my view at a press event, behind the reporters, behind the cameras. setting up the podium and helping to prepare them both with talking points. On the right-hand side is actually it's a picture that I had of a press conference being held outside of our building, advocating for change in medical cannabis policy. And in the bottom right-hand side is again our cabinet secretary. We had a press event celebrating our work in telehealth, which is essentially in rural areas of New Mexico. Instead of having to travel all the way into Albuquerque or Santa Fe or a population center to get treatment, working with your doctor in your local community via teleconference with specialists at the hospital. And in particular, this was our partnership around tuberculosis and the reductions that we've seen in TB as a result of telehealth. And then this week, while I've been in West Virginia, we had the governor come by one of our small town public health offices during our back-to-school immunization campaign to just come by and meet with kids and families. We wanted to get a few good pictures that we could share on social media. She has been a champion of childhood immunizations during her time in office. Really during these last months of the governor's term, we've worked really hard to make sure that together with other agencies and with the governor's communications team, to get her out into the communities, to show people the impact that policies over the last 8 years have had. And so this was fun. We had a press event canceled. The media didn't show up, so we didn't even set up the podium. And we just got some pictures and put out our press release later that afternoon. That's the end of my prepared presentation, but I'm actually, let me come back here. It's not the end. We skipped a question in there from the polling, so pull your phone out again. Let's just open this up for questions. If you have, I'll ignore that one, sorry, whoever put it in the wrong, insightful in the wrong place, that was my fault. If you have a question about how to speak to the media that I can help address here, go ahead and throw it in there.
To start themselves and then they came to you asking for help, or is it something that you
It was. No, it was the first. And it was an example of how local news stations receive some direction from their corporate organizations, the company, because it wasn't just KOAT7, but it was all her stations that were doing something similar. But they even had a primetime special across the country. It was 2 hours long with Soledad O'Brien, who does her Sunday morning news show across the country, and they pulled these kinds of stories from, I think there was one from West Virginia. One of these ones that had previously been on our evening news was on this national special. Again, looking at different angles of it, but we've been more than glad to help out wherever we can, kind of with editorial.
would go and present that type of series or that idea to them so that it could be covered? Because in this case, it was a positive spin for you.
We should. Now you got me thinking of other news organizations we could do that with. But yeah, absolutely. We've had good conversations, and I mentioned, like, getting together with Associated Press is one example that comes to mind, because we do like to get together with them from time to time. I'll go by their office and chat with them about whether it's that or what we have upcoming on Zika virus or West Nile virus and mosquito control, or any wide variety of topics. Yeah.
When you're setting your guide,
So yes, absolutely. It's easiest when you do set some kind of a timeline. Say, yeah, I've got Dr. Landon for you. He has about 15 minutes, or he has 10 minutes, or half an hour. Will that work? And then getting that feeling from them, they are looking for something more in depth. They want to sit down. They want to get multiple shots. Whatever they want to shoot some B-roll. whatever that looks like. But yeah, because it's true. Your subject matter experts, their time is valuable. They have other work than working with the media. I also try to be there whenever they have the interview, so that I can help keep things moving along as well. So that if that kind of situation does start to happen, I can just kind of say, thank you for your time. We're done. Yeah, Eric.
What cues do you give?
I'm fortunate to have really good subject matter experts who we've trained and prepared. We, as in like me and my predecessors, over many years. I worry about what will happen when Dr. Landon leaves, because he's probably going to retire over the next several years and take with him a wealth of knowledge. But he has been good in working with us to, and I'm taking a roundabout way, I'll answer the question. He has been good to help identify those who he would like to see get some media experience, and will give an interview to someone who has never talked on camera before on a lower priority or a lower risk situation, so that we can get them some experience. It's not as much cues from the subject matter expert as much as it's just me observing and being ready to jump in if something got missed, or if it's of course harder to take something back if they say something you had prepared them not to. Whenever possible, we try to write down our talking points and go over them before we go out and meet, right before we go out and meet the reporter. At the front desk, so that it's fresh and we're ready to go. Yeah.
How are you casually intervening?
It's a good question. It's easier to do probably afterward. I mean, you're talking about intervening, like stopping them from don't say that. And yeah.
Do you ever feel like the press is in print?
All the time.
And
If it's in print, if it's gone in the newspaper, the thing is that they still have a web version of their story that lives on forever, and so there's been times I've had to call the reporter and ask them to make a correction, and knowing knowing kind of their situation, just suggesting that they change it online. I'm not asking, it's never been serious enough I've needed a full retraction printed in the newspaper the next day or anything, but making changes. There's also some degree of they got it wrong, but what are we going to do about it at times? And you just kind of move forward. I've faced stories or different issues where there's negative reporting about the department or about our secretary, or medical cannabis is a great example. There's a lot of pressure for her to legalize cannabis for opioid relief, and in her research, there hasn't been enough scientific evidence to support making that decision at this time. But that doesn't stop the medical cannabis community from advocating for it, and some of maybe the negative press that's been out there. We try to counter it with just maybe an accurate story from a larger outlet, or counter it with a positive approach the next time around.
Can I just add to that?
Yeah.
I would say editorials. I've been working on this with the clients. Editorials, we've submitted editorials from our CEO.
And op-eds are a great way to work with, to bring in that expert voice. So yeah, they reported it this way, but what if I can get the chief nursing officer to write about an issue, or a partner, get UNM Hospital to write on something, or yeah, absolutely. Cool, thanks guys.
thank you so much.
Yep.
Sorry to